Good evening. My name is Daniel Huth. I am going to be speaking about the Foley Catheter. It's a rather important and rather old piece of medical equipment. It's been used by different cultures at different times throughout practice of medicine. And so, what is it exactly? It is a tube that is inserted into your urethra using sterile technique to drain your urine from your bladder. And probably one of the first questions somebody who's not too familiar with the procedure or the tube in general may be asking is, why would I want a tube in my urethra? Several very important things are, namely, to closely monitor urine output, especially if you're getting diuretic drugs, if you have a condition such as congestive heart failure, where the heart does not pump strongly enough to remove extra fluid from the tissues in the extremities. Diuretic drugs can help pull some of that fluid from those tissues, and you start putting out more urine. It's very important that you measure the output of urine versus the intake of fluids by how much fluids you're getting in through an IV or drinking to how much you're putting out to make sure that those drugs are being effectively used. Another reason would be to assist you with urination if you are unable. There are some conditions such as benign prostatic hypertrophy, which is often seen in older men, and it can be an early sign of prostate cancer. And it is where the prostate, which is the gland that goes around the urethra, swells up to the point that it closes it off. And this causes obviously the bladder to fill up, causes excruciating pain, can make you pass out. And the bladder is made of smooth muscle tissue, which as it expands causes a hormone feedback that will eventually make your kidneys shut down, can cause buildup of minerals and so forth in your bloodstream, can kill you very well by not peeing. And another very important reason to have a Foley catheter is if there is a bleed, which can spontaneously happen in the bladder if you're over anticoagulated, something like this. The tube is then put up there and it is irrigated. We'll talk a little bit more about this later. It's irrigated so that clots do not form and you have another kind of blockage inside the bladder so that everything drains through nicely. And sterile technique we're going to talk about. It's very important when inserting a Foley catheter because the urinary tract is a sterile tract. Urine that comes out of your body is 100% sterile. The kidneys are a filtration process. There's an osmotic gradient between your blood and the nephron of the kidneys that is used to filter out all manner of different things from urine, metabolites, hormones, proteins at different times. And so it's very important to talk about sterile technique. As you can see, these people here are using probably for some type of operation or another. And why is sterile technique so important? And what is sterile technique? It is the practice used by healthcare providers to minimize the likelihood of receiving a hospital-acquired infection. Hospitals are havens for microorganisms. I'm sure you've all heard terms such as MRSA, VRE, which are drug-resistant bacteria and can cause septicemia and death. And again, the urinary tract, this is a typographical error. The urinary tract is sterile. Lack of proper sterile technique can result in UTIs. And UTIs can lead to pyelonephritis, which is an infection of the kidneys. Change in mental status in older people, which is not exactly understood why the urinary tract being infected can cause change in mental status, and just in older people again, but it does happen. Sepsis and again, death. Male versus female, and I figured this picture was somewhat appropriate as the pelvic girdle, where the the urethra is found right about here. So this is a male and a female pelvic girdle. The female slightly wider, allows for childbirth, and so forth. And there are very special considerations, as obviously males and females have very different anatomy, particularly in this region. And considerations in the male. Some very important things to think about in the male, as I mentioned, benign prostatic hypertrophy. Older men in general do have enlarged prostates. It's not all, it doesn't have to be to the point that to where they have the condition BPH and they're having daily trouble with urination, but it can also be just by having a somewhat enlarged prostate. It can be very difficult to pass the tube through the prostate gland. So sometimes you have to use a more rigid catheter, which is called a coude, And that's up to an experienced clinician to decide which kind of catheters to be used. Other considerations are that a special kind of lidocaine jelly can be used to numb up the entranceway. Obviously, with men, since you have a much longer tube going in there, which is the shaft of the penis, is that it can be very painful. By squirting in a lidocaine jelly, it can help with that burning feeling as it goes in, can make men a lot more comfortable. One last thing to consider with men is that there is a condition called hypospadias, in which the meatus, or the hole where the urethra exits the penis, is actually seen somewhat down the shaft of the penis, and it's literally, there's just nothing up here. The hole's like halfway down here. It looks really weird to somebody who's never seen it before, and if you're first getting into a health profession, it's important that they tell you that. Nobody told me. The first time I saw one, I was horrified. And then considerations in the female are that it's important to note that the female anatomy, when looking at it straight on like this, the clitoris is at the top, the vagina is at the bottom, and then in between the two is the urethra. And I actually once had a female. It was a mother of a 2-year-old girl, probably young 20s mother, in the emergency department, who, when told that her 2-year-old daughter was to get a catheter to get a clean urine specimen, she said, "So what, do you just stick that in her vagina and the pee comes out?" And I said, "No," and I thought to myself, no, and if you don't know that much about your body at this point in your life, maybe you should have thought before having children, if you're willing to, bring children into the world. So, other considerations are that lidocaine generally isn't any real use because, as I said, compared to men, the length of the urethra is very short, and because there's not really anything to grasp onto, and it's often difficult to find the urethra, trying to get the lidocaine jelly in there is often much more painful than just kind of going at it with the tube with plenty of lubrication. So, one last consideration, especially in older women, is that there's a condition called atrophic vaginitis, where because of atrophy of the vagina, where it's not used, by sexual stimulation, is that the urethra can actually kind of get sucked up inside the vagina. And my first time that I had an experience with this, we went and looked at it with a speculum, a vaginal speculum, saw it, about an inch or two in there, and then a couple of us just kind of had a pass, and finally I found that if I lubricated the finger and the catheter at the same time, and just kind of went in and pushed up, and it went in, and it was the urologist was in the process of being called in. We got to call him halfway on his 45-minute ride into the hospital and say, "Nope, don't need you to go home." He was like, "Thank God, it was like 3 o'clock in the morning." So. Nursing procedures, as I said, continuous bladder irrigation is very important for if there is any kind of bleed, inside the bladder, to make sure that clotting and then urinary retention doesn't occur. Intake and output, it's just called INO amongst nurses, is monitoring very closely how much fluid being put in, how much is coming out, and obtaining clean urine specimens. And the catheter, I have one here. I'm just going to kind of pull out real quickly to show you, since I've gotten away. But normally this will be handled in a sterile fashion. And here it is. Thank you very much, ladies and gentlemen.
Very nice job.
Thinking about it.
Volunteer.
Male volunteer.
I love vaginal atrophy or atrophy.
I'm not going to talk about any of it.
Whatever.